right, guys. Yeah, man. Y'all see it on your screen. It says from um, it says the Republican House budget resolution potential $880 billion in Medicaid cuts by congressional district. So yeah, like you remember when Trump froze Medicaid payments, he froze food stamps temporarily. And then the judges, they said, hey, you can't do that because the Congress has to authorize that shit to go through. So hey, I told people like this ain't over yet. Like the this is what Republicans want. Republicans want to cut this shit. They want to cut Medicaid, and they want to cut Social Security. They want to cut food stamps. Like that's why I don't. I mean, I know a lot of people say you should like talk about Republicans too. I am now, but the Democratic Party supposed to be the party that supposed to be the working people's party. So that's why y'all probably see me criticize the Democrats more than the Republicans. So yeah, this is no surprise. Hey, what they always say, you can't get them in the rinse, you get them in the wash. No, yeah. If I botched it up, I apologize, man. Man, my headspace is all over the place today. But let me continue. This comes from Center of American Progress. Um, it says, I'm finna read it. It says, uh, it should be very small. It says Medicaid and the Children's Health Insurance Program cover essential life-saving health care for nearly 1 in 4 Americans. Wow. Um, Apparently, the Republican Party do not give a shit about your child or your grandma, grandpa being healthy. Like if they die in sake of a billionaire getting a tax cut, then so fucking be it. Let me continue. It says including low income individuals and families, pregnant women, seniors, and people with disabilities. For nearly 8 million people, 80 million people covered by Medicaid or CHIP. Those programs being able to see a doctor when they are sick, or obtain the medication that they need, or afford home-based care or nursing home services near the end of life. It says the Republican House budget resolution currently under consideration interrupts the House Energy and Commerce Committee to cut at least $880 billion in costs through 2034. Based on previous proposals from House Budget Committee Republican leadership, these cuts are widely anticipated to come from the Medicaid program. It says all states rely on federal matching funds to finance their state Medicaid and CHIP programs. A new analysis from the Center for American Progress explores the potential reach of these cuts by congressional district. It says Table 1 shows potential federal funding losses by district if the $880 billion in cuts were to be um, proportional to current Medicaid and CHIP enrollment using 2023 American Community Survey data from the U.S. Census Bureau. On average, each congressional district could lose $2 billion in federal funding over 9 years. Wow, that's crazy. It says why it's still unclear exactly how the energy and commerce community would achieve 880 billion in Medicaid cuts. Proposals previously floated have included adding burning some work requirements to the program, or shrinking the federal medical assistance program that provides states with significant support to help finance their Medicaid programs. An analysis by the Urban Institute estimates that a reduction in the F, FMAP rate for just those Medicaid enrollees eligible under the Affordable Care Act's Medicaid expansion option would lead to 15.9 million people losing Medicaid and CHIP coverage in 2026 if those states cannot make up the shortfall and drop their expansion as a result. Urban's coverage reduction estimates by congressional district for a scenario are also shown in Table 1. It says districts with high levels of Medicaid and CHIP enrollment, such as California's 22nd District and Kentucky's 5th District, could see especially high losses in nearly 5 billion and 67,000 fewer enrollees per year, and 3.6 billion, roughly 95,000 fewer enrollees per year, respectively. So yeah, man, this is the table right here, man. Like, um, that's crazy. Of course, the red states didn't do the Medicaid expansion under the AC the Affordable Health Care Act, um, as y'all can see. But yeah, man, like this. Then it says cuts to federal Medicaid funding would have far-reaching consequences, with states being forced to either raise taxes or scale back program eligibility, limit covered benefits, or lower reimbursement rates to providers. Um, so, yeah, that's it right there, man. Like, yeah, like, unfortunately, man, a lot of people will be hurt by this. You know, I mean, like, see, this is, and this is consequences of, you know, this is on both parties because I feel like that, um, one party pretends like, no, we will expand it, by, increasing, it's means tested to get Medicaid if you live, like I live in a red state, you gotta make a certain amount of money per year or per month to get on it. Like I make too much money according to them, which is not too much because everything's so damn high. Like eggs is off the charts high at this point. Like I have to ration eggs because I use eggs as part of my breakfast, in the morning. But yeah, grandma and grandpa they actually needed Medicaid, part of Medicaid and Medicare. Like they'll be screwed, and kids like that's crazy about the conservatives. They always family values and all that shit, but they always don't do what they always preach. They do the opposite. So yeah, man, it's unfortunate, but I mean, like y'all thought Trump and the Republicans was gonna just stop it what the judge said. Like, hey, let's go back in the budget and just cut damn near Medicaid down to literally nothing. $880 billion. Like, jeez, like it's sad, man.